My name is Michelle Edwards, and I am an occupational therapist with the Calgary Early Supported Discharge Program for stroke and brain injury. This video is going to review some of the Canadian Stroke Best Practice Guidelines for upper extremity management after stroke. The Canadian Stroke Best Practice Guidelines report that arm and hand function is frequently reduced following stroke, limiting stroke survivors' ability to perform activities of daily living. Unfortunately, a large number of stroke survivors with initial arm weakness do not regain normal function. However, many therapeutic techniques have been developed for those individuals who have minimal arm movement. The Canadian Stroke Best Practice Guidelines recommend that clients should do meaningful, engaging activities repetitively in an effort to enhance motor control and improve function. Clients should also be encouraged to use their affected arm during functional or daily life tasks, like folding clothes, buttoning, pouring, and lifting objects. We will talk more about these principles a bit later on. It is important to regularly stretch the muscles in your arm in a safe manner. If you are able, this can be done alone or with the help of a family member or caregiver. If anything you do causes pain, stop the activity. If possible, stretch your arm daily to prepare for using it in everyday life tasks. The Stroke Best Practice Guidelines recommend passive and active assisted placement or movement of the upper limb in a variety of safe positions within the patient's line of sight. For safety and to help reduce the risk of causing shoulder pain, passive stretching should be below 90 degrees or shoulder height for shoulder flexion and shoulder abduction. One example of a way to complete shoulder stretching in a safe manner is to do it with your arms supported on a table. You can place your affected hand on the table with your less affected hand on top, and then you slide your hand across the table until you feel a stretch in your shoulder. If you are able, another way to achieve a bit more of an active stretch would be to slide your hand and arm up along a stair railing or banister until you feel a stretch on your shoulder. Another important principle is to think about keeping your arm positioned away from your body when you're at rest so that you have space between your arm and your body. You could just do that by having your arm supported on an armrest in a chair or a couch, or supported on pillows like I have. This is especially important for people who are experiencing a lot of tightness in the muscles of their chest or their elbow. Every individual's stroke recovery is different, but if you are able to actively move your arm, the more you are able to use it, the better the potential for recovery. Research shows that many repetitions of an activity is needed for recovery. We would encourage you to speak with your healthcare provider or therapist prior to starting a program and for guidance on progressing the program. There are various things people can do at home to help promote recovery of their affected arm. The Graded Repetitive Arm Supplementary Program, or GRASP, is an exercise program that can be completed as homework by a client with support of family or a caregiver, and is typically introduced by a therapist who monitors the client's progress. GRASP is for individuals who are able to at least shrug their shoulder and extend their affected wrist. They also need to be able to communicate if they are experiencing pain and follow the program instructions. Please refer to the link at the bottom of the slide for more information about GRASP. There are helpful links on the website for therapists, patients, or caregivers. Now I'm going to talk about things that you can do with only your affected arm. Things like turning light switches on and off, opening doors or cupboards, your refrigerator, the dishwasher, turning the water tap on and off, drinking water from a glass or a mug. And if you're unable to do that, maybe just trying to bring an empty mug or glass to your mouth. Picking up and eating finger foods, or even just trying to bring your hand up to touch your chin. You could also try holding a fork or spoon. Again, you can try to bring that to your mouth. Just holding pens or pencils like you would need to for writing or beginning to practice writing. Could also hold and release a ball to work on opening your hand. You might also have some cards lying around. You could work on flipping or dealing those cards or turning the pages of a book or newspaper. You could hold or carry a laundry basket if you have adequate balance to do this safely. You could also work on folding laundry, whether that's holding it in the air or resting it on a tabletop or your lap while you do it. You could also practice tying shoelaces or managing zippers or buttons on clothing. And you don't have to be wearing those objects. You could be holding the shirt or a pair of pants in your lap to practice or have them on a table. Another thing you could do is work on cutting food or just place your hands on a computer keyboard to see if you can work on typing. You might also want to work on doing things like using your affected hand to stabilize a jar while you open it with your other hand. You can do this with any type of container really, or you might want to try using your affected arm to open different kinds of containers. These types of tasks are just as important as any exercises you might be doing, and you can easily incorporate them into your day as you go about your routine. Even though they might be frustrating, the goal is that if you keep on performing these tasks, it will hopefully continue to promote recovery. To help reduce the risk of developing a painful arm, things to avoid include pulling on your arm to stretch it or using overhead pulleys for a stretch. If your shoulder blade and your upper arm bone aren't moving well, and we try and force the movement by pulling on your arm or using pulleys, it can cause shoulder pain. Other things to avoid would be keeping the arm and hand tight against the body during the day or allowing the hand to stay in a fisted position. It's also important to try and avoid compensatory movements like hiking your shoulder or flexing or tipping over through your trunk when you're trying to do some reaching tasks. For those people who are unable to or really struggle to open their hand, you can attempt to place objects like a water bottle or a ball in your hand to try and help it stay open. You could even hold on to these items while you are walking if you don't need to be holding on to a walker. If you're unable to grasp and manipulate objects, you could still try reaching for them without the element of grasping for them. If you aren't able to actively open your affected hand, trying to remember the principle of keeping your hand open and away from your body, perhaps placed on a flat surface, is something really good to keep in mind. To recap, try to engage your affected arm in daily life activities, even if you are not actively participating in a therapy program. To the best of your ability, do multiple repetitions of an activity throughout the day to try to enhance the motor recovery of your affected arm. Nothing replaces the value of using your arm in any way you possibly can, but the movement has to be pain-free. Consult with your therapy team for strategies and activities to progress your rehabilitation. This concludes the presentation on upper extremity management after stroke. If you have any questions or concerns, please reach out to your family doctor or local health center. You can also check out the Canadian Stroke best practice links listed on this slide. Thank you for listening.